Hello and welcome to my YouTube channel. Today we are going to talk about the 4 horsemen of the apocalypse. Do you mean the black fungus, the white fungus and the yellow fungus? Yes, the more appropriate term would be Mucor, mycetes, Candida and Mucor septicus. These are just the 3 horsemen of the apocalypse. What's the 4th one? Well, the 4th one is Aspergillus. Asper what? Aspergillus is a common mold named by an Italian priest and biologist Pier Antonio Micheli in 1729. But why Aspergillus? Why not Godzillus or something? Father Antonio named it Aspergillus as the molds resembled an aspergillum, which in Latin meant a holy water sprinkler. Holy crap, that's weird. Do you know where these fungi are found? Yes, I do. I've seen white fungus on Einstein's head, and black fungus on MJ, and yellow fungus on Johnny Bravo. Aspergillus. I suppose it was in the holy water used to exorcise Linda Blair. Ha ha, very funny. Black fungus or mucormycetes is commonly found in soil, air, plants, manure, and decaying vegetables and fruits. It is also found in the nose and mucus of healthy people. White fungus or Candida is found on most of the mucosal surfaces, mainly the gastrointestinal tract, skin, mouth, throat, gut, and vagina. The yellow fungus or Mucor septicus is commonly found in lizards and reptiles, while Aspergillus is found both indoors and outdoors. It is a saprophyte found in dead and decaying organic matter as well as stored grains and compost piles. You are telling that these fungi are already found in healthy humans, but they don't cause any disease? Most of these pathogenic fungi reside as commensals on mucosal surfaces of healthy people. What is a commensal? A commensal is any species which lives in the host, deriving food and shelter from the host without harming the host. Interesting, but when do they cause disease? When the opportunity is right, that is, if the host immune system is compromised through disruption of the body's protective barriers, or if there is an imbalance in the resident microbiota of the host, which helps inhibit the growth of transient pathogens, or in case of immunodeficiencies, chemotherapy, or recovery from surgery, overuse, misuse, or prolonged use of antibiotics, as in the case of Candida infection, and prolonged use of immunosuppressive drugs like steroids in severe COVID-19 cases, also by increasing the exposure through unhygienic conditions and exposure to rotting food and highly humid environment which favors fungal growth, and pre-existing comorbidities like diabetes, impaired kidney function, or cancer, and the more recent use of industrial oxygen cylinders. What are the symptoms of these fungal infection? Black fungus or mucormycetes causes mucormycosis. The rhinocerebral symptoms include fever, one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of mouth that quickly become severe. Pulmonary mucormycosis symptoms include fever, cough, chest pain, and shortness of breath. Gastrointestinal mucormycosis symptoms include abdominal pain, nausea, vomiting, and gastrointestinal bleeding. Cutaneous mucormycosis symptoms include blisters, ulcers, blackening of infected area, pain, inflammation, rash, and swelling. White fungus or Candida causes invasive candidiasis. Multi-drug-resistant Candida auris is a nosocomial nightmare in COVID-19 patients. Invasive Candida auris affects the blood, heart, and brain, and can even lead to death. Candida auris was just discovered in 2009, and its misidentification may lead to patient getting the wrong treatment. Yellow fungus or Mucor septicus causes lethargy, weight loss, reduced appetite, and in more severe cases, it may lead to leakage of pus, slow wound healing, sunken eyes, organ failure, and necrosis. Aspergillus species cause aspergillosis of the following type: allergic bronchopulmonary aspergillosis, allergic Aspergillus sinusitis, aspergilloma, chronic pulmonary aspergillosis, and invasive aspergillosis. However, COVID-19 patients experience a rare sinus pulmonary aspergillosis. Symptoms include weight loss, cough, coughing up blood, shortness of breath, and fatigue. Nasal aspergillosis symptoms in COVID-19 patients include stuffy or runny nose, congestion, fever, facial pain, and headache. Infection may spread to other parts of the body, including brain. What is the treatment for this fungal infection? Amphotericin B is a gold standard antifungal antibiotic used to treat life-threatening infections like the black, yellow, and white fungal infections. Voriconazole and anidulafungin are also the drugs of choice. Isavuconazole is a second-generation broad-spectrum triazole used to treat invasive aspergillosis and mucormycosis. However, the multi-drug-resistant Candida auris, the white fungus, is resistant to all three available classes of antifungals. Do you have any more questions? Yes. Mirror, mirror on the wall, which is the most deadliest of them all? The white fungus, the multi-drug-resistant Candida auris, is the most fatal as it's resistant to all known antifungals. How to protect oneself from these 4 horsemen of the apocalypse? Following COVID infection, one has to take extra precaution to avoid opportunistic fungal infection by avoiding exposure to the pathogenic fungi, by keeping the environment and surfaces clean, by maintaining personal hygiene, by using fans in place of air coolers, by reducing the humidity, by avoiding the excessive use of antibiotics, by avoiding unnecessary and prolonged use of steroids like dexamethasone and pyridoxine for COVID-19 treatment, by avoiding the use of questionable life support equipment like the industrial oxygen cylinders, by proper intake of highly nutritional food, by getting rid of rotting vegetables and fruits, by building one's immunity through proper sleep, well-balanced nutritional diet, adequate physical workout, breathing exercise, and meditation, by keeping one's blood sugar levels in check, by wearing masks, face shields, and gloves when necessary, by maintaining social distance, judicious use of sanitizers and hand wash, intake of vital nutrients like vitamin D, C, zinc, iron, and selenium to boost one's immunity, and staying home is the best and the safest way to stop contracting, disseminating, and containing a potential infection. Adios, amigos. I am going to lock myself in my laboratory to keep away the 4 horsemen of the apocalypse.